Hi guys, this is how to insert an indwelling or a Foley catheter in a female patient. So make sure that you have the orders to insert the catheter. Make sure that there is an actual reason that the catheter needs to be in place, because with it being in a patient for a long period of time, it increases their risk of infection or a CAUTI, a catheter-associated urinary tract infection. So what you need is gloves and then just the Foley catheter kit. So I'm going to set up my table, make sure the patient knows what's going on, explain the procedure to them, answer any questions that they may have, wash your hands, put your gloves on, set the bed to the appropriate height. And then I'm going to open up the kit. So the outside of this kit is entirely non-sterile. You can touch any aspect of it. The inside, of course, is sterile. So I'm gonna put it in the center of my table. And this kit's nice because it has kind of a whole entire sterile sheet, so you can put stuff on the side. When you're opening it, open away. You can touch the outer 1/8 of the inside, but not the middle. So I like to kind of make sure it's in the center, all that good stuff. So I'm going to take my sterile gloves out. They're right on top. And then the outside also completely unsterile. The inside is. So I'm going to set up a little area over here away from my sterile field to open up these gloves. So it's your preference whether or not you want to put the sterile gloves over your clean gloves. I usually like to take them off, but it's your preference. We're going to pretend there's a trash behind me. And then don sterile gloves. And if you forget the procedure, have no fear, it's in another video. Right, inside sterile, use that, toss it away, and my hands are sterile. So now, in this kit, you have little drapes that you can put under the patient. I usually slide this underneath them in case. Make sure you do not touch the patient's legs or any part of the patient. There is another drape with a hole in it. You're more than welcome to use this. You don't have to. There. Also, there are swabs to clean the area in the kit. This pack has 2 packs of 3. There is a pre-filled syringe to fill up the bubble or the balloon in the catheter, because these stay in the patient, so when you insert it, you want to blow up the balloon so that it stays in place. There is lube for the catheter, and then underneath this part is the full Foley bag itself. So the first thing I'm gonna do is kind of get all my stuff situated here. And there's also a urine specimen cup. So I can lay this stuff on this sheet just because this is all sterile. So it's still maintaining the sterility. So I like to take my lube, put it in the top, just so I have it. And you can just put it in right there. Throw that away. So then I'm going to take these swabs and clean. So with females, I like to clean starting on the inside and working my way out. Since there's 3, you can do like side, side, middle. Not sure if these are okay or not on the mannequin, so I'm gonna mask it. So I'm gonna clean, throw it away. Another one, clean, throw it away. Another one, clean, throw it away. So since my hands didn't touch anything on the mannequin, they're still both sterile, but if you went and kind of like spread her labia or anything, this hand then became unsterile. So just kind of keep that in mind. Next, I have to get all of this ready. So I like to have this already open and kind of like primed a little bit. And then I'm going to move this box over here. So this is different because it has the whole drainage bag. So this bag technically doesn't need to be sterile, and the sterile part is wrapped up in here. So I'm going to extend this so I have some more room and put that at the foot of the bed. And then take this part with my little lube and my balloon and bring it closer to me. So my hands are still sterile. I'm just taking this part out. And I like to wrap it around my hands because you don't want this catheter kind of flying crazy everywhere, because just if there's anything in the environment in the air, it can get on the catheter. So I'm going to dip the catheter in the lube. Make sure you get it all lubed up so it hurts less. I'm then going to make my right hand my sterile hand, my left hand my unsterile hand. And so I'm going to spread the labia, and obviously on these mannequins it's easier to see. The top hole is the urethra, the bottom hole is the vagina. So a key tip is kind of just aim upwards and you'll get it. So keep putting that through, and then once it's in the bladder, you'll kind of see urine start to drain through. Obviously this is a mannequin, there's no urine. So that was the sterile part of the procedure, and now you're gonna blow up the balloon catheter, the balloon part of the catheter that went inside the patient. So you can take this, and there's 2 ports. So there is the balloon port, which is this one, and then the port right here is one for if you need to get a sterile sample of someone who has a Foley in. So I'm going to connect this here and push the air in, the water in, sorry. And that will blow up the balloon. And then that helps it not come out. And I'm gonna move all my stuff and clean up so nothing's sterile anymore. This, you're gonna hang it on the bed. And there's attachments that are usually in the like supply rooms or anything that you can attach to the patient's leg. That just kind of ensures that it holds this in place so it doesn't get accidentally pulled or anything down here. So I'm going to take this, put the bed down in the lowest setting, cover back the patient, make sure that their call bell, any belongings are in reach, and that's it. So just to show you what it looks like when you do inject the water into the catheter, it blows the top up, so the whole balloon, and then this is what kind of sits on the edge of their bladder. So obviously the urethra is small, so this whole balloon's not going to come out, so that kind of leaves this in place in the bladder. And then when you want to remove it, make sure you deflate the balloon before just trying to pull it out, because one, it probably won't come out and it'll be very painful for the patient. So just reattach this and suck it up. It will eventually deflate, and then you can pull it out.